Appreciate you waiting, and I appreciate you tuning in. And thank you, members of the press, for being here. As a reminder, I'll be here every Wednesday at 1 o'clock, here today, and back again next Wednesday at 1 o'clock. As you can see, things are changing every day with coronavirus all across America, all across the world, actually. We're kind of entering a different phase. Cases are going up. We're coming upon the holidays. So I am asking you to keep yourselves informed, keep yourselves alert, keep yourselves aware. So tune in at 1 o'clock on Wednesdays if you can. If you can't, please sign up for a daily email at governor.ri.gov. But it's probably more important than ever that you stay informed so you have the facts and so that you can keep yourselves and your family safe. Okay, we'll begin as we always do with the data, and I'd ask you please to put the dashboard up on the screen. The numbers aren't good. I'm not going to sugarcoat it. You will see yesterday we reported 156 new cases for a test positive of 2.8%, almost up to 3%. By the way, you'll note that this dash is the same dashboard we put out yesterday. We're still waiting on some data from one of our labs, so later today we'll update it for the most up-to-date data. The bottom line is we're not in a good place. These are not the trends that we would like to be seeing, and it's clear that we have community spread all across the state. By the way, we're not alone. Pretty much every state in America right now is seeing their cases increase. Our neighbors are, Connecticut, Massachusetts, really all around the country. I would say we are in we're at a very important point right now. So we're not where we want to be. Cases are increasing. Test positivity is getting up to 3%. That's high, that's too high. However, we haven't yet crossed that threshold where we would be into what some people are saying is a second wave, or where we have a runaway train. And so that's why I'm asking everybody now, let's buckle down right now. We have spent the past 7 months building warning systems, testing systems, contact tracing systems. We have a really fine-tuned machine so we can get ahead of the problems. This isn't the spring. We know what we're doing now. We know where the cases are. We can pinpoint the problem. But we have to take action. Now, you're saying, Governor, I am taking action. I'm doing everything I know how to do. I wear my mask. I'm being careful. I'm washing my hands. And I hear you. Man, do I hear you. I'm all set with this virus, too. But the thing is, it's still here. So today I'm going to give you a few additional things that you can do right now in this moment in time so we can keep Rhode Island, keep our economy open, keep our schools open, and keep ourselves on a good path, and try to get a bit of a plateau instead of continuing to rise up that curve. Last week, our percent positive was 2% in the week. A 2% positivity for the week is high, and it's continued to tick up week after week. The new cases last week was 149 per 100,000. So way above the 100, which is that red line on the screen before you. It's the highest that it's been in several months. We did see a slight decline in new hospitalizations, down from 116 to 94. So that's good, but we're still seeing double-digit new hospitalizations every single day. So again, it's just not where we want to be. Okay, I want to start off talking briefly about testing. I announced a week ago that Rhode Island, like every state in America, is receiving for free from the federal government a new kind of a test from Abbott called the BinaxNOW testing system. Rhode Island is going to be receiving 300,000 of these test kits by the end of the year. That's a big deal. You know, that's exciting news, and the BinaxNOW is a completely different kind of testing. It doesn't require any machines. It's very rapid. You get your results in 15 minutes, and frankly, it couldn't have come at a better time. Last week I was asked how we're going to be using our allocation of 300,000 tests, and today I want to share that with you. In consultation with our testing task force and advisory group, we have decided that by Thanksgiving, we're going to be deploying the BinaxNOW tests, 300,000 of them, in 3 areas. In our K through 12 system, in our community health centers, with a focus on high-density communities, and at our colleges and universities. But we believe that by using the test in these 3 scenarios, we can quickly identify positive cases. So in K-12, in high-density communities, in colleges and universities, there's a need for speed. We need to quickly identify positive cases and get people into isolation. And so that's how we've chosen, that's going to be our strategy starting on or about Thanksgiving. And I want to give a huge thank you to Dr. Alexander Scott and also the Testing Task Force for your work in advising us. I will say, different states are doing different things. You know, some states are just doing all congregate care, some states are doing just nursing homes. This is what we've decided to do because we think it's where we need the help and, as I said, where we need speed. On the topic of testing, I want to remind everyone to go get tested. Even if you feel great, even if you're not sick, consider going to get a test. You can sign up for free asymptomatic testing at portal.ri.gov. So that's for any Rhode Islander. It's free. You don't need insurance. Portal.ri.gov. Especially if you're working, if you're back to work, if you're a teacher, hairdresser, waiter, waitress, bus driver, work in a manufacturing operation. If you haven't been tested yet, if you're a member of the clergy, if you've been seeing your friends, if you went out for dinner last weekend with people who you don't normally see, go ahead and get tested. It's free. It won't take long. Make sure you get an appointment. Portal.ri.gov. I've been asked a couple of times at this press conference, hey, Governor, when I try that, they say I need insurance. They say I have to pay. So we've triple checked. If you're getting that message, you're going to the wrong website. Maybe you're calling your maybe you're calling your doctor. Maybe you're going to one of the independent labs websites. I know it's confusing, but the state-run portal.ri.gov, you ought to be able to get an appointment within a few days and get a free test. Last week I set a goal of doing 4,000 asymptomatic tests in the week, and we got to about 3,500. So that's great. Not as good as 4,000, but I'm really happy with that. So that means 4,000 people between when I asked you last week, 3,500 people went out last week after Wednesday and got a test. And these are people who aren't sick. That's the important point here. This is for folks who don't have symptoms. By the way, I've heard from some people, friends of mine, who said, hey, I listened to you, I feel great, but I went out and got a test, and by the way, I'm positive. That's what we're trying to do here. The name of the game right now is to identify as many positive cases as possible, as fast as possible, and get folks into isolation and quarantine. So if you're one of the 3,500, thank you. And if you're on the fence about it, I'm asking you please to go ahead and get tested, even if you feel terrific. This is a very strange virus. We're learning more about it every day. And there's a lot of folks out there who test positive but who have no symptoms. And it's really important we find you and put you in quarantine. Testing is not a silver bullet, but it's a very important tool in our toolbox. And I want to ramp up our testing as we head into this next phase of the virus. Okay, shifting gears, I want to talk a little bit about Thanksgiving. It's around the corner. It's a lot of people's favorite holiday. It's a great time of year, and it's going to be different this year, like everything about 2020. Thanksgiving is going to be different. So You know, we just have to know that and realize it and deal with it the best we can. So my request to you is to keep it local this year. I know that's tough, but I'm asking you please to consider staying home for Thanksgiving, even if you typically travel to see aunts, uncles, family, and friends. And it's not, there's no one's forbidding you, there's no official regulation. I'm just telling you, it's in the state's best interest if everyone stays local. It's in our public health interest, it's in the interest of our economy, and it's in your interest because you'll stay healthier and safer. The reality is, if you're traveling, you're seeing people who are not part of your consistent group. By definition, if you're traveling to see somebody who you don't live with, who you don't know, you're expanding your group. If you get on an airplane to go travel, or a train or a bus, that's doubly true. It's a higher risk. And obviously, if you have any symptoms at all, we don't want you traveling. By the way, there's other risks. There's a risk you might get stuck where you are, because if you do travel, you know, you have to, if you get sick where you are, you can't travel home. And these are federal guidelines. You're not going to be able to get on an airplane if you have a fever or if you're sick. You're going to have to show a proof of a negative COVID test. And if you happen to be visiting and you spike a fever or you get sick, you'll be stuck wherever it is that you are. So the bottom line is, in light of everything, it's just probably not worth it to travel this one year. And I'm asking you to consider adjusting your plans to keep it local, you know, maybe have a virtual dinner with your friends who are in other states. We're coming into a tough period. Halloween, followed by Thanksgiving, followed by Christmas, Hanukkah, New Year's, holidays, having to come back indoors, flu season. It's going to be a rough couple of months. So if there's any concrete thing that you can do, like not traveling over Thanksgiving, we really would appreciate you doing your part for Rhode Island and keeping it local. Having said that, you may decide, for whatever reason, that you want to go be with family or friends. You may decide that you want to have your traditional Thanksgiving where you invite over 20 friends and family. I really hope you don't do that, but you may do that. You may say these are our traditions, and you are determined to spend your holiday the way you always do with all your friends and your family. So if you're going to do that, then we have a particular ask of you, which is to be very careful in the 14 days leading up to Thanksgiving. So I'm asking you now to make your Thanksgiving plans. I'm asking you to keep them small, celebrate with the people you live with, and stay local. That's terrific. However, if you're making your plans and you say, no, we want to have all my family over and we're going to be safe, fine. Do that and be safe. But if you're going to do that, for the 14 days before Thanksgiving, I want you to really avoid social gatherings, avoid non-essential activities, avoid travel. Like, make sure that you and the people you live with are going into Thanksgiving healthy and negative. You probably ought to go get a test in the days before Thanksgiving, even if you're asymptomatic. This is the best way to avoid spreading the virus to your loved ones, and for us as a state to avoid having major problems in the weeks after Thanksgiving. We learned a lot when we brought the students back to college. The colleges and universities all around the country and in Rhode Island told their students they had to quarantine for 14 days before coming back to campus. As a result, when the students showed back up on campus, the percent positivity on college campuses was astoundingly low. So much so that all the experts said, this data can't be right. It was right. Kids wanted to get back to school, so they followed the rules. They did the right thing. They stayed in their houses for the 14 days before going to college. They got tested. They were all negative, and they showed up free of the virus. So that's what I'm asking you to think about doing. If you want to have a Thanksgiving holiday that's more normal with people in your home, or you want to go to somebody's home, then take it easy in the 14 days before the holiday and the 14 days after the holiday, and go ahead and get tested right before the holiday and maybe a week after the holiday. Because if you happen to get sick, we want you isolated. Okay, with that in mind, I want to share some guidelines that we've developed for a safe Thanksgiving celebration, and I'd ask you to please put that slide up. On your screen, there's some tips and suggestions for a few ways to safely enjoy the holiday this year. And I'm putting them up now in advance of Thanksgiving so we can get our mind around the fact that this is going to be a different Thanksgiving. By the way, I want to say this. Please, please follow these guidelines no matter where you are. These are guidelines for safe Thanksgiving. Get in your head, commit yourself to having a safe Thanksgiving. Whether you're in Massachusetts visiting grandma, you're in Rhode Island, you fly to see friends wherever you want to, these guidelines should follow you. Wear your mask, even if you're in someone's house. If they're people you don't live with, it is safer to wear your mask. Stay 6 feet apart, constant hand washing, constant hand sanitizer. Don't share food, don't share drinks. Avoid close contact activities like the family football game in the backyard. I know that's a tough one, but it's not safe. If you really have to do it, wear your mask, keep it brief, touch, no tackle. Like, do everything you can, guys, please. You know the rules. You know the rules. Wash your hands, stay 6 feet apart, do not leave your house if you're sick. Wear your mask, even inside. Eat outside if you can. These are all the things that'll make a difference. In an ideal world, your in-person Thanksgiving would only be with the people that you live with, the people you're around all the time. Maybe you could host a virtual dinner for your family who doesn't live with you. Maybe you could cook a meal and deliver it to your loved ones and have a very brief visit. Maybe, bring some food over to your loved ones and sit outside for a little while. Share photographs or Zoom. There's a lot of creative things we can do, and if we start thinking about it now, we'll have a better Thanksgiving. We put together a little illustration of what a safe Thanksgiving might look like, and I'd ask you to please put that up on the screen. So, this is obviously doesn't necessarily look like anyone's house, but it's the concept, which is in one home, separate the groups. Certainly, if you have older family members, mom, dad, grandma, grandpa, keep them separate. Keep them in a different room. Maybe have some folks eating outside, some folks in the living room, some folks in the kitchen. If you're going to be moving around throughout the house, put your mask on. Keep your mask on. You'll notice a computer on the table in that picture. That's a family, virtually including their friends who aren't in the house with them. So over the past 7 months, we've learned how to do this. We've learned how to be creative. And I'm just going to say, there's enough talk about what we can't do. So I'm going to challenge you to have a great Thanksgiving and do it safely and get creative. Get creative and find new ways for this year, for Thanksgiving of 2020, to have a great time, but be ultra safe since we're not in a good spot right now as it relates to coronavirus. In that spirit, I want to take a second to talk about Halloween. Same thing. It's going to be different this year. I'm excited to announce the Safe and Spooky Halloween Contest, sponsored by the Department of Education and the Rhode Island Foundation. We're challenging all Rhode Island students to share how you'll be celebrating Halloween this year while following the public health guidance. I've already seen some pretty awesome, creative, fun, safe ideas. Virtual pumpkin carvings, building like a candy slide out of PVC pipe so you can shoot the candy out to the kids. Lots of fun stuff happening. So I would encourage the kids to get creative. Ride's going to pick some winners with the most creative ideas, and there's going to be cash prizes. There'll be 3 winners from each school category. So 3 winners for early learning centers, 3 winners from elementary schools, 3 winners from middle schools, and 3 winners from high schools. And each kid who wins will get $50. So it's a fun thing, and you can earn a little bit of money. Submit your ideas to backtoschoolri.com by Tuesday, October 27th at 4 o'clock to enter the contest. And we'll announce the winners and share the best ideas on the Back to School RI website. Okay, a couple more things. Switching gears entirely, I want to talk for a minute about a new initiative we have, or in addition to an initiative related to the economy. Today, I'm excited to announce a new resource available to job seekers through our Back to Work program. So, as a reminder, the Back to Work program is an initiative that we started with our federal stimulus money to help people who've lost their jobs since March to get a new job, and to get free job training, and to get a new job. So today I'm announcing that in partnership with Google and a local nonprofit called Research Improving People's Lives, we're going to be launching a virtual career center and a first-of-its-kind artificial intelligence-powered job matching tool to help Rhode Islanders who are out of work. So if you're out there, if you've been laid off or furloughed from a retailer, the mall, construction, architect, I mean, it's, a hotel, there's so much job loss. Check this out. Check this out. We want to get you a job. You can go to backtoworkri.com and you do a few things. First, there's job openings up there right now, and we post more every day. So you can see if there's a job interesting to you. There's also more than a dozen job training programs. So if you see a job that looks good to you, but you think you're not qualified, sign up for a job training. It's free. This is what we're putting the COVID stimulus monies to do. You can get the training that matches with that job. But now, because of what I'm announcing, you can also chat virtually with Skipper. Skipper is our new virtual assistant, and Skipper will direct you to available job resources. So you can complete a career recommendation assessment. You might not know what you want to do. You might be, you might say, I'm ready for a change. So let us help you figure that out, what you want to do, and give you a hand in getting into a new job. You'll fill out information about your skills and interests and receive personalized notifications specifically to you when there's a job opening that might be a good fit. A month from now, a few weeks from now, the site is also going to be housing our virtual career center, bringing together all of the state's job resources and supports, and you'll also be able to schedule a virtual meeting with a career coach and a job recruiter. And as I said, this is part of the existing $45 million commitment to the Back to Work initiative. I'll say this, I've been governor for 6 years, and I've been at this business of job training for a while. And sometimes the hardest part is matching people up. We have companies who right now in Rhode Island are looking to hire between now and the end of the year over 3,000 people. And they know what they're looking for. And at the same time, we have so many Rhode Islanders who are willing to work hard and desperate for a job. The hard part is linking up the two. So that's why I'm really excited about this Virtual Career Center and this Back to Work initiative and the partnership with Google, because this is that. So if you're out there and you're struggling, first of all, don't be ashamed, because so many people are. Check this out. Go to the Back to Work RI website, have a session, put in your skills, put in your interest, and let us see if we can match you up with a new job. Speaking of jobs, I want to make an announcement about manufacturing. I want to acknowledge the manufacturing and construction industries who have been early leaders in helping us deal with COVID-19. I allowed manufacturers and construction sites to stay open the entire time, which was different than most states in America, because I trusted them to do the right thing, and they have, by and large, done the right thing. And I want to announce today that the Rhode Island Manufacturers Association, in partnership with the state, has created a manufacturing auditor program where a point person at each manufacturer audits their own operation for compliance with safety protocols. This is a fantastic idea, and I cannot thank REMA, the Rhode Island Manufacturing Association, enough for your leadership and stepping up to be part of the solution. I also want to thank the construction industry, who's recently created training videos on how to follow COVID safety protocols for safe construction sites. We know, look all around the country, there are outbreaks in manufacturing operations. You have to be in person to do the job, and you're often in close quarters. And so what this is there's an auditor in each operation, an employee there whose job it is to make sure that that company is keeping folks safe. It's a great idea, and I want to say thank you. Finally today, I just want to take a moment to thank the people of Rhode Island. This is getting long in the tooth for everybody. And we're not through it yet. There's light at the end of the tunnel, for sure. Every day we get closer to a vaccine, but we're not there yet. So to our doctors and nurses, teachers, bus drivers, grocery store workers, nursing home staff, caregivers, public safety, all the frontline workers, many of whom have literally not had a day off since this started, I want to say thank you. Your jobs are the hardest. They've sometimes been scary. And your courage and resilience is an inspiration to me, and they keep us going. And I'm very proud of you, and I want to say thank you. I also just want to say a big thank you to the people of Rhode Island. You know, it's a scary time. Everybody's on edge right now. Everybody is on edge. There's not a person who hasn't been affected negatively in some way by this virus. And so I just want to acknowledge that. You're worried about yourselves, you're worried about your job, you're worried about your family, and it's just a tense time in America and in our state right now. The people of Rhode Island have distinguished yourselves in America as a people of resilience, innovation, caring about one another, following the rules, not for yourself, but to keep your friends and family and coworkers safe. And we've broken all kinds of records. Testing, highest per capita in America. Contact tracing, among the best in America. Asymptomatic testing. You know, time and time again, we continue to show the country how this ought to be done. Child care centers open first and most successfully. 2/3 of our kids back in school, So what that tells me is that Rhode Island is capable of great things. You are capable of great things, of great innovation, great resilience, and just rising to the challenge that has come upon us. Nobody wanted this, but it's here, and we're dealing with it. It's come to us. So I guess I'm asking you to continue to challenge yourselves dig deep, to challenge yourselves every day to live carefully as we enter these next couple of months, which are going to be critical and will determine, how bad this virus is going to get. So every day, wear your mask. Let's set new goals for mask wearing. We're leading the nation in testing. Let's lead the nation in mask wearing. Set a new goal for how you and your family are going to have a Thanksgiving that is fun but safe. 3 weeks after Thanksgiving, I do not want to be up here saying we're going back to phase 2, shutting down restaurants, we're in full-blown up the curve surge. I don't want to do that. We won't do that, but everybody right now has to say, all right, what am I going to do? What am I going to do in a concrete way in my daily life to keep a lid on the virus? And even though you're tired and fatigued and sick of it, frankly, as am I know you have it in you because you've been just fantastic and strong from day one. I would encourage you to think of small, concrete things that you can do in the course of a day or a week, because every one of those will add up. Having said that, it is a time of stress and strain, and I want to remind everybody that it's okay not to be okay. We are struggling, people are struggling, even more than ever, with anxiety, with depression. All of that is exacerbated by distance learning, kids alone at home, exacerbated by a job loss, exacerbated by anxiety. So if you're feeling unsteady or depressed or anxious or suicidal or you need help, you're not alone. You are not alone. Don't be ashamed, get help. You can call if you're an adult and you're struggling with mental health issues, call 414-LINK. 414-LINK. That's for adults. It's 24/7, and we will get you to the right place of care depending on your needs. If you're a kid or the parent of a child, you can go to bhlink.org, bhlink.org, which is for children. I also have one final ask. Family Service Rhode Island launched a Be Safe campaign at the beginning of this to provide food, soap, and other necessities to families in need across the state. Since March, they've delivered over 26,000 kits of basic necessities to our hardest hit communities. We are running out of money. All of that happened on account of fantastic donations by the people of Rhode Island and foundations. We're entering the holiday season. It's getting colder. Needs are going up, and our coffers are shrinking. So I am here to say, if you're in a position to help, please text Be Safe to 44321. 44321, text Be Safe, and make a donation. It's the holidays, it's a great time to give. If you're lucky enough to be able to give, whatever you can give, $1, $10, $100, $1,000, it adds up. Or you can visit FamilyServiceRI.org and see their website and make a donation to the Be Safe campaign. So with that, I'm going to turn it over to Dr. Alexander Scott, and I will take your questions. I will simply end by saying there is definitely light at the end of the tunnel. We continue to get vaccine briefings. Progress is being made, and in the background, in addition to doing everything we're doing with contact tracing and testing and such, K through 12, we're preparing for vaccine distribution, and rest assured, when they're ready, Rhode Island will be first in line so we can get Rhode Island back to a place when we can, move on at some point in time next year to a life where we don't have to live quite the way we're living with an ever-present coronavirus.